Okay, welcome to the COPD Wellness Podcast. Today we have a special guest all the way from San Francisco, I believe, is Dr. Brianna Stubbs. Brianna, how are you today?
I'm well. Is it morning or it's the afternoon for me here in San Francisco? So I'm guessing is it the next day in the morning for you over in Australia?
It is. It's 7:21 a.m. in the morning on a Saturday morning, and I'm looking outside to blue skies.
I appreciate you getting up that early to chat to me then.
Well, I think you probably know, as people who participate in marathons and Ironmans, early mornings is our thing. So it was pretty
I've got
easy.
a 5:30 a.m. meet time for my 22-mile run tomorrow morning. So I feel you there with the early mornings.
Fun and games, isn't it? The things we do to ourselves.
I only got a couple more weeks left before I race now, so I'm doing it's my first ever marathon. So I'm not a veteran like you, but my first race, and it's on the 2nd of December. So I'm excited to see if all of the awful stories I've heard are true.
No, you'll love it, especially going across the finishing line.
Yeah, that's the best.
Now, for our audience, can you give us a bit of a background about who you are and what you do?
Yeah, sure. So my name is Brianna Stubbs. I am the research lead at HVMN. So we commercialise ketone ester drink. So I actually did my PhD over at the University of Oxford. I worked with Professor Kieran Clark and Dr. Pete Cox, and they kind of also collaborated with Dr. Richard Veach. And so I was involved in the development and research into the beta-hydroxybutyrate monoester, ketone ester. And so I did a lot of tests with athletes, looking at how this affected performance, looking in some military populations as well. And then part of my PhD, I spent a lot of time comparing the different ways that ketone esters and ketone salts affected the body. And just also my kind of hobby alongside my PhD was rowing. So I was on the Great Britain international rowing team and won the world championships twice while I was studying for my PhD. So a little bit of an athlete, a little bit of a scientist. And then just as I was wrapping up my PhD, Professor Clark and HVMN made an agreement to launch the ketone ester drink and take it from being a research chemical into being kind of a product that people can buy. And so it seemed like a really great opportunity for me to transition the skills that I had from my PhD and come and make it a reality. It's been quite a journey the last 6 months, the last year, making it all happen.
Excellent. And I believe you're a little bit of an athlete and may have had some experience rowing as well.
Yeah, so I won the World Championships in 2013 and 2016 in the lightweight women's double and the lightweight women's quad. So I trained sort of 20 hours a week alongside studying for my PhD. It was tough.
At this stage, probably a lot of people listening to this podcast are thinking, okay, ketone esters, HMV, what's this all mean to us? So I guess if we take it back a little bit, what we're starting off with is a ketogenic diet, which many people who follow my blog and my podcast would know that I've been a big advocate for that. Could you explain a basic summary of what a ketogenic diet is?
Sure. So a ketogenic diet, by definition, is one that makes the body ketogenic. So one that makes the body produce ketones itself from fat. And so there are a number of different ways that you can kind of make your diet ketogenic. You can either fast, even though that's not technically a diet, it's kind of a way of eating that's making your body produce ketones, or you can restrict the carbohydrate content of your diet and take that right down and eat more fat, and that makes your body switch from relying on carbohydrate as a source of energy to relying more on fat as a source of energy. Now, the body, most of our body can burn fat very easily, but our brain, it can't burn fat. Fats don't very easily cross the blood-brain barrier. So if you're eating low carbohydrate and high fat, you need to figure out some way of fueling the brain. And that's where ketones come in. So the body converts fat into ketones, and ketones can get into the brain. So when you're on a ketogenic diet, a lot of your body is running off fat. Your brain is actually running off ketones that are made from fat. Is that a good summary?
I think so. And I guess it's a lot of people talk about low carb, high fat diets and working out what level of fats and what level of carbohydrates, I guess, is individual from person to person. But the basic thing is that what we want to do to be in ketosis is to restrict the carbohydrates enough to produce ketones by eating enough fat. So
I think the recommendation for people starting out is to aim for 50 grams of carbohydrate a day as a rough reference.
Yeah. So moving forward from that, HMB ketone ester is a way of getting into ketosis by bypassing the diet. Would that be a good way of putting it?
Yeah, so we've talked about being ketogenic just a second ago, and that's when the body is making ketones. And then the word ketosis, there's a lot of confusion around what that word actually means, because in the science literature, technically ketosis just means that you have ketones in your blood. It doesn't mean that you're making them, and it doesn't mean that you're burning them. It just kind of means that they're there. But a lot of people say, oh, well, to be in ketosis, you have to be burning fat. Well, no, to be in ketosis, you just have to have ketones in your blood. So if you drink a drink that has ketones in it, you will be in ketosis. You'll have more ketones in your blood, but you won't necessarily be making more of the ketones yourself or burning more fat yourself. So ketone drinks are certainly a shortcut to being in ketosis, but they're not a shortcut to making your body ketogenic, let's just say. So the drinks are a very rapid way of providing ketones as an energy that your body can burn. But what's interesting, and what I'm sure we'll discuss in a bit more in a minute, is that when you have ketones in your blood and when you're in ketosis, those ketones aren't just being used as a fuel. They have various effects throughout the body, effects on inflammation and effects on gene expression that are interesting. Even when you take out the fat burning, weight loss kind of thing, the process of getting ketones in the blood through the ketogenic diet.
Yeah, and that's exactly the direction I'm going in. So if you're listening to this podcast and you're a patient, a COPD patient, or a respiratory patient in general, this is what we're trying to get to, is how can ketones affect respiratory disease. Now, we've started to see the science come out in relation to inflammation and how ketone bodies can affect inflammation. And given that COPD and a lot of respiratory diseases are driven by inflammation, do you see that there's a potential for a ketone ester to work in conjunction either with medication or as a standalone product into the future for patients with respiratory disease?
Yeah, it's a fascinating question, and I'm really excited to be working now with a number of different researchers in lots of different fields, not actually COPD, but I think we can there's a shared mechanism, inflammation, to many diseases. And so I think some of the findings from different diseases will have relevance to COPD patients. The short answer is yes, I think there's a lot of possibilities there, because as I was saying, when you have you can drink ketone drinks, and that will rapidly raise the level of ketones in your blood, equivalent to if you'd been fasting, or the diet, in fact, in most cases higher than if you were able to do those things very well. So after a ketone ester drink, your blood ketones could be 2 to 5 millimolar. If you were on the diet, you were saying that you can get your ketones up to maybe 1.5, 2. It's quite difficult to do that, though. You have to be quite strict, and there's a lot of individual variability. So you can drink a ketone drink, and within half an hour, you'll have 3 millimoles of BHB ketones in your blood. And then that BHB ketone, that can help to reduce inflammation, and it has sort of different effects on the immune system. It's almost... I don't want to say that it's like a drug, but it's almost like a drug, the profoundness of the effects that we've seen in some of these animal models. It's hard to think. I think the best way to kind of compare it is if you have a big double gulp size thing of sugar and glucose, like syrup, your blood sugar will go up and then it will go down, but that's actually doing things inside your body. It's making you release insulin. It's triggering off a number of cascades and processes. So actually drinking a double gulp size thing of ketone, and the ketones go up and the ketones go down, it will similarly trigger off pathways in the body, but they're actually broadly more helpful pathways, anti-inflammatory pathways, things that can help with resolving disease, rather than pro-inflammatory like sugar. Now, I think where we're at right now with the research is that most of it's been done in animals, but there's a number of different disease models that have been looked at, where they've looked at specifically the activation of part of our immune system that's called the NLRP3 inflammasome. So that is a very central hub that releases inflammatory mediators and is an important part of disease. And so especially in some diseases of the brain, they've been looking at NLRP3 inflammasome, and that's a lot less activated when you inject ketones, so synthetic ketones, or if you put animals on a ketogenic diet. So I think there's a lot of promise there. It'll be interesting, and it's certainly something that I'll be pushing for us to look at in our upcoming experiments with the ketone ester.
Yeah, that's the exciting part for me, and I understand, as a scientist, you can only say so much in relation to the potential of something, and I guess my own experience, as you know, has been really positive with not only using the ketogenic diet, but what I've been able to show with the ketone ester as well. And I think for me, the big thing seems to be that suppression of inflammation. You look through the scientific papers and they talk about, in relation to COPD, suppressing NLRP3, things like oxidative stress reactive oxygen species, all those things which are part of COPD. Beta-hydroxybutyrate, which is your main circulating ketone body, can suppress those sort of inflammation markers. So I guess, as you say, we've really only seen that in animal models and my N=1 sort of demonstration. So moving forward from there, for me, I look at the potential of something like a ketone ester as perhaps being a 3 or 4 times a day supplement a patient could take that could potentially keep them in a ketogenic state, and how that would affect inflammation. I guess one of the things we don't know, or do we know, is what sort of effect having constant ketone ester supplements would that have on the body, and is there a downside of doing that?
Well, I suppose the first thing to say is that the ketone ester is approved as generally recognized as safe by the FDA. So that means in order for us to sell it, that we've submitted a big dossier of safety and toxicology and things like that to the American FDA, and that's been independently reviewed, and they've given it the rubber stamp for us to be able to distribute it. And so, the company, since we launched in April, we've sold like tens of thousands of servings, and nobody's dropped dead on us, no bad side effects reported yet. So I shouldn't joke about that kind of thing. But we for something to be regulated as a food by the FDA, they have to be very convinced of its safety. We're even now we're in the process of extending out the safety studies that have been done. Recently, a longer safety study being wrapped up over at the University of Oxford, and so we take safety very seriously. But there's nothing that's sort of come up to date that we would be kind of worried about. And I guess to go back again to the example of glucose, we high bolus of glucose day in, day out. So in some people that can result in disease, but I think that ketones at a much lower level are likely to be a lot less harmful than bolusing glucose 5 times a day like we do when we drink all those cans of soda.
Yeah, look, definitely, and the fact that ketones are made in our body ourselves, so you would have to suspect there's not really any safety issues. I guess at certain levels, people talk about ketoacidosis and the effect that can have. Yeah.
So there was a great physiologist. I don't know whether you've ever heard of the Krebs cycle. Some people may call it the citric acid cycle. It's a chain of enzymatic reactions that makes energy for our bodies. And Hans Krebs, the guy who discovered this cycle, was one of the most, he's like the forefather of physiology. And so he once described there being a very big difference between physiological ketosis and pathological ketosis. So if you take someone and fast them for 50 days, then their ketone levels reach a kind of a plateau. So there's this natural level where our body kind of stabilizes out. And if you have uncontrolled diabetes, you go way past that level. So the physiological ketosis is around about 6 or 8 millimolar. That's where the body will go up, and then it hangs out there, doesn't carry on getting higher. But it takes a long time to get there, days and days, 20, 30, 40 days. But pathological ketosis, that'll be within a few hours of poorly controlled diabetes, and they'll have levels of like 20 or 25 millimolar. So there's 3 or 4 times order of magnitude different between this like lower level and the dangerous level that we see with diabetes. So I think that's not something people should be concerned about, because even taking exogenous ketones, levels don't really even get up to that physiological level. Typically levels after a ketone ester drink are more like 3 or 4 millimolar. I have seen people get to 6 or 7, but that's kind of rare. If you took more of it, you could get higher, but we think that there's kind of, I like to call it like a Goldilocks spot, where it's like not too much, not too little. It's just right, just in the middle. Not, you need some ketones, but not too many.
Yeah, I think you're right there. I know with my experience, both through fasting and through using the ketone ester, the highest I've seen my ketone levels has been up around 6.1, I think it was, millimolar. So that was after a 5-day fast. But also, I think that was the levels I got to before the Boston Marathon when I was using the ketone ester. And you're right, once you sort of get to that level, it doesn't seem to go any further. Whether the body regulates that, I'm not sure. But what I found interesting is subsequent usage of the ketone ester has seen that now my ketones don't really get past about 4.4 when I use the ester, whereas I have had readings at 6. So I don't know whether that's something where my body's adjusting or what, I don't know.
Well, maybe if you were using it every day or like very regularly, that the body might change. But if you're using it sort of just a little bit ad hoc, I would be surprised if you were adapting to using it. I mean, there are a lot of different things that can affect the short-term readings that you get. I mean, first thing is that often the handheld meters aren't always the most accurate. They might have like a margin of error of 0.2 either way, but that's not going to account for all of the differences that we're seeing. Also, even things like the time of day, like how much blood flow is going to your gut, that's going to affect how quickly it's absorbed, how recently you just ate, whether you drink it with more fluids, things like that are all going to have small impacts on the effect. But possibly if your body is getting more adapted at using ketones as a whole, so if you're using it and you're in the middle of a very strict period of ketogenic dieting, then maybe your body is better positioned to metabolize and break down ketones. But it's kind of all a little bit speculative at this stage.
Yeah, I agree, and I think maybe what you're eating, whether I was in a fasted state, all those sort of things can play a role in whether your ketone levels are up, down, or indifferent. Going back to when I first tried the ester, and I guess this is what got me interested, and to give people a bit of an idea, I was in London doing the London Marathon, and after the race, I found it pretty hard to stick to the diet over there. One, because it was hard to source food, and 2, I just wanted to drink beer and celebrate. So that's what you do. I visited Professor Clark's lab about 4 days after the marathon to talk to her about the ester. And she had noticed while we were talking how breathless I'd become, and she couldn't believe I'd run a marathon, 4 days beforehand. Yeah. So she gave me a sample of the ester, which I took. And that's what really triggered my interest, because within an hour, my symptoms had subsided. I'd become less breathless. My wife and one of our sons were in the car with us driving back to London, and they made the comment, your breathing seems to be a lot more under control. So to me, that's what got me interested in the ester, is that my own experience suggested to me that there was something at play here that was suppressing my symptoms, and that started on the road of the whole journey through the ketone ester. So I guess a lot of people are listening to this and thinking, oh, wow, we can take a shortcut and we can go and buy the ketone esters. But At the moment, we're not quite there yet for a number of reasons. Do you see the ketone ester is expensive at the moment, but that's quite normal when things first come onto the market. I remember when you used to pay about $6,000 for a plasma TV, and these days you can pick them up for $500. So it's a good example. Do you see a stage where a ketone ester will be affordable for not only patients but for the average person to take on a regular basis?
Oh, for sure. I mean, this, as you say, a lot of this is just working out how we can manufacture it at scale. So we really hope that if we were to make another order that was bigger of the ketone ester, make another batch of it, that would be significantly cheaper. And that's even planned within the next sort of year or 18 months or so. So we have clear, it's not just, we want to make it cheaper for everyone. It's certainly a pain point for us and something we're working really hard to address. So, and I hope that within the next year or so we'll have news, because in theory, the process to make it itself and the precursors don't have to be terrifically expensive. In theory, it's only 1 or 2 steps more complicated than sugar. It's not a difficult process. So we're hoping to be able to figure out some good economies of scale and things like that to bring the price down. In terms of whether or not it's a shortcut, I mean, I think the best advice is then you're going to get the best outcomes if you use it as a complement and as an adjunct to all of the other things that are important to managing a disease. Any medications that you're on that aren't giving you bad side effects, dietary modifications. I don't think it's ever going to be a good idea to have ketone ester in one hand and a iced glazed ring donut in the other hand, for example, and the media want to portray it a bit like that, this is a shortcut to ketosis, and they just confuse ketosis with weight loss, and they're like, oh, donut, ketone ester, it's all great, when in reality ketone ester still contains calories. It's still a calorie source, and so for weight loss it's not going to magically melt fat off you, and in fact taking a source of ketones in yourself actually relieves the need on your body to make as many of them. So for that period of time where you're burning the ketones from the drink, you're not making and using ketones so much from your own body. So I think what we've seen is there's a bit of a switch point. So you'll take the ketone and your levels go up, and as they come back down again, natural production will come back up again. So we've seen that especially people on the ketogenic diet, they don't go up and then go back to zero and then come back up again. There's not that much of a lag. But certainly you'll get the peak from the ketone ester, and that's all from the drink. So if you still want to get the benefits of the ketogenic diet, or a number of them, especially to do with weight loss, you still need to follow the ketogenic diet. And you can't, there's not very much that you're going to take that's going to cover up certain sins, let's just say. I wouldn't like people to go away thinking it's a shortcut. It's certainly a shortcut to raise ketones in your blood. But there's more to it than that.
Yeah, look, that's a really good point you make, and it's probably one I should have made earlier, that I don't think that a ketone ester is ever going to replace medication or a good lifestyle, but where I think it really works well from my own experience is when you use it in conjunction with diet, medication. I mean, my own measurements I've done seems to suggest that being in ketosis actually enhances the effects of your medication. So whether that's because the suppression of inflammation is so good with a ketone, it allows your inhalers to get further into the lungs.
Yeah, maybe.
There are things we just don't know at the moment, but I think when we're looking at something that can potentially help COPD patients, it's worth exploring. We haven't really seen any new medication in COPD world for 20 odd years. So, many patients are looking for something new to come onto the market. We've seen our medication get delivered in different ways, but the actual medication itself is still the same. So for me, this is exciting.
Say that you guys, when you're looking at treating any disease, you want the broadest range of weapons or tools in your toolkit that you can. And then because of individual differences and location differences and slight differences in the disease, like there's any number of differences between people, what we think that we might be able to provide through ketone drinks or ketosis is like a whole new tool that people can have a go with and manipulate and see whether it combines well with what they're already doing that works for them. It's certainly not like throw out all of the other things that you're already doing and replace it with this.
Look, absolutely. And what you said there is so important. It's I see my job is to try and show people all the different tools you can put in your toolbox, and as you say, select what works for you. Because I think that's one thing that we're getting better at with COPD, but we need to get a lot better at. And, that's also about patients becoming more willing to accept and to self-manage as far as their disease goes, not expecting that their doctor's going to fix them on every 3 to 6 month visit, because it doesn't work like that. It's like anyone, the better you look after yourself, the better outcomes you're going to have, especially when you have a particular disease. So, having a ketone ester to be shown to enhance medication and improve symptoms will be fantastic. Excuse me. But it will just be a tool in the toolbox, as you say.
Yeah, I mean, I think it's one thing that saddens me, and I don't know how like the COPD community is around this, but I know quite a few people who work in the diabetes community, and you have some people who are like intensely motivated to try and do what they can to manage their disease, and then on the flip side, you have people who are so frustrated and like tired out of the whole thing that as you kind of just described it, they kind of expect their doctor to just fix everything, and for them to be able to carry on living their life as they would have done before they had the disease. And they don't really care about the consequences. And with diabetes, you end up with ulcers, and you end up with retinopathy, so you lose your vision, and you end up with kidney disease. And if as a diabetes patient you take that approach where you don't engage with your disease, you really, really decrease your own quality of life and create a big like financial burden on like the healthcare system or your insurance or whatever, or on you. And here in America, like, I don't know, I think in Australia you guys have a similar healthcare to what we have in the UK, where the government will subsidize it. So I think people can get away with a bit more there. But here in America, some people go bankrupt because they can't afford, like someone will all of a sudden get cancer and they'll be having chemotherapy. And I met someone who'd had to sell their house and was living in like a mobile home because their insurance, just like, it's kind of crazy, the implications of not managing your disease properly. So I think you can either be like a switched on patient for any disease and like think, do some thoughtful sample experimentation, listen to what the doctor's saying and change your lifestyle to try and control your disease and, keep yourself healthier. Or you can just kind of, the way not to do it is just to go the other way and sort of despair and just ignore it, because that's not going to help anyone in the long run.
No, and that's right. I mean, we can rely on medications and all sorts of things, but at the end of the day, any patient, regardless of what your disease, is always going to have a better outcome if they've got a good lifestyle and they're exercising, they're eating the right types of food, which I guess is a whole another area that we could talk about for hours. Is what is the right types of food? But going back to, from a patient's point of view, and you just mentioned diabetes, is many COPD patients develop diabetes after they have COPD. So it's relevant with the cross-section of diseases that COPD patients have to deal with. And we've seen studies recently showing that the ketogenic diet has a very positive effect on diabetic patients, and I believe Dr. Finney and Dr. Volek have shown they are able to reverse type 2 diabetes in patients.
Yeah, I mean, without wanting to get into too much of a debate, there's an interesting use of the term reversal there. So just to flag up with the listeners, the controversy there is, so what they've done, and they do some fantastic science, is that they can take people off medications. They put people on a ketogenic diet, and they give them a lot of support. So they give them coaching via a mobile phone app, and the person has a health coach they can call whenever, and they're part of communities. And so this program and this very heavily supported way of delivering the ketogenic diet has had like tremendous success. And Verta Health, Dr. Volek and Dr. Finney's company that they're affiliated with, has done a really fantastic job of publishing those results in peer-reviewed journals, so everyone can see how successful the program's been. So people adhere to the diet well, their markers of diabetes improve. So there's this one called glycosylated hemoglobin, HbA1c, and that goes down. So there's less glucose being bound to the hemoglobin, which is good. A lot of people come off medications, which is also really good. But I think that the question from the skeptics is often, reversal must mean that they could then go back onto a regular diet and not be insulin resistant. So that's where the point of debate comes in. I think from a patient's perspective, being able to come off the medications and lose weight and all of those things is probably enough to be considered reversal for a patient. But from a skeptical, anti-ketogenic diet scientist, Twitter troll, they'll be saying like, well, have you really reversed diabetes if if the problem of insulin resistance is still there, but just you can't see it because you're not eating any carbohydrate. So they've done some really fantastic work, and with the ketone ester, we see similar or a possibility for a complementary effect. So we've seen that when you take ketones and drink, that will help drop your blood glucose in a similar way to taking medications, actually. So we actually had Professor Tim Noakes visit us here at HVMN, and he took the ketone ester, and the drop in his blood glucose, he told us afterwards, was the same as if he'd been taking his usual metformin. Yeah. So it was like a pretty not just a small, meaningful drop in blood glucose. And then also recently, the University of British Columbia published a research study where people drank some ketone ester and then did what's called an oral glucose tolerance test. So you drink ketone ester and then you have a cup that's basically a double gulp soda. It's like 75 grams of sugar, and they measure your glucose and they measure your insulin after that. And so typically you drink this big lot of sugar and your glucose goes up a lot, your insulin goes up a lot, and your glucose comes down. And if you're diabetic, then your glucose will go even higher, and it'll stay higher for longer because you're not as good at regulating that with insulin. Your body's not responding well to insulin. But with the ketone ester, the blood glucose didn't go up as much. So it seems like the ketone ester is having some benefit on how the body handles glucose. So certainly interesting interesting possible use case for ketones to complement what's going on already with the ketogenic diet.
Yeah, your comment about metformin there is quite interesting, because I know there has been studies, and I think there might be still ongoing studies, using metformin in relation to COPD, because what they see in hospital settings where patients are admitted with an exacerbation of their disease is very elevated blood glucose levels. And they're looking at how that affects the exacerbation, whether that's causing or whether it's a result of the exacerbation. But what they're doing is using metformin to try and control that blood glucose level. So, for a COPD patient, there's another example how an ester or the diet may help.
Well, I think the ester is interesting in this one because not only, for example, our blood glucose typically will rise in a stressful situation. So linked to cortisol and linked to adrenaline, things like that. So if you have an exacerbation, I imagine that's quite an intensely stressful experience for the body. It's trigger, you're broadly in an inflammatory and stressed state. So not only would ketones bring down the glucose, but they'd probably also be treating the upstream inflammation as well. And this is actually a really nice opportunity to talk about one of the things that is unique about ketone drinks compared with the diet. If you have an exacerbation, you can drink a ketone drink there and then and be in a state of ketosis, so have ketones in the blood. But if you had never tried the ketogenic diet before, or even if you were typically on the ketogenic diet, to really get a big bump in ketone levels, you'd need to, as you said, fast for a day or two. It's not a quick, naturally isn't a quick way of getting ketones in the blood. As far as the drinks, they are quite quick, and you could almost see a setting where, for a number of diseases where ketones were helpful, you could just give a drink there and then at the time of injury or a time of stress, and help treat the situation, rather than being like, oh, well, what would really help you now is ketones. Go away and like eat a ketogenic diet for a week, and then by that point you've missed the window where you could really, really help.
Yeah, definitely. And I mean, I guess that ties in with the experience I had at Oxford with Professor Clark, that I was able to take that ester, and, you know, as I say, within an hour my symptoms had returned to my normal, I guess. Definitely. So I've probably taken up a lot of your time at the moment. One question that I think comes up, and hopefully you'll be able to answer in the COPD community when we're talking about ketogenic diets, is the whole fat argument. And, you know, fat, although I believe it's been saturated fat in particular, has been proven not to be the main contributor to cardiovascular disease, there still is this big stigma around fat, and people associate with ketogenic diet with high fat, and you can't eat high fat. What's your thoughts on that?
Well, I agree with you that I think that fat's been like fairly unfairly demonized. I think that the problem is with metabolic syndrome, let's just say generally, like when fat is unhealthy is when it's consumed with a lot of carbohydrate as well. So the typical Western diet, and actually what the diet that you'll give lab animals to make them fat, isn't a high fat diet, it's a high fat and high carbohydrate diet. So it's typically, you know, there's some good research that shows that you can be like improve health outcomes and lose weight on a very high carbohydrate, very, very low fat diet. And then equally on the other side of the spectrum, when you've got high fat and very, very low carbohydrate. But it seems like the combination of those two things is what's like particularly bad news for people who are trying to be healthier. It seems as well like where the fat in your body is a problem as well. Whether you have a fatty liver, for example, that can make your outcomes a lot worse. So really, it's not, I think as well, a big problem is that people assume that, you know, butter and fat that you see written on a label or that you eat is immediately equal to that fat that we, don't want on our bellies and stuff. And actually there's a lot of tightly regulated metabolism that controls how anything that we eat gets kind of deposited in our body, let's just say. So I don't think that fat is at all inherently like worse than any other nutrient, carbohydrates or protein, but anything in excess or anything in the wrong context is bad for you. And so, I know there are definitely people out there who don't like the calories in, calories out model. I wouldn't say I was like fully bought into that. And I do think the type of calories matters also. But if you overeat anything, if you consistently overeat by 1,000 calories a day, that's overloading your body with substrate. Even if you add ketones into that as well. We always say to people, if you're going to put in ketones, you have to take out the calories from somewhere else. So you have to be fueling your body for its needs. And then once you've kind of got that kind of balance right, then you can look at the amount of fats and carbohydrates that you're eating. But fats are certainly not inherently unhealthy. We evolved eating fats. The obesity epidemic itself is a relatively recent thing. And it kind of, I don't want to do direct like correlation causation, but there's just so many things in our environment that have changed. For eating fat isn't necessarily bad for us. It's just the context that we eat all foods, including fat, has had a bad outcome.
Yeah, and I know my own experience. So since I started on the ketogenic diet over 2 years ago, I fairly quickly lost about 5 kilos in weight. And initially I was a little bit concerned about the amount of weight loss, but then it just stabilised. And since then, my weight has not really fluctuated, except for some silly experiments that I've done along the way. But I guess they show those experiments is when you throw in carbohydrates and fat in equal sort of amounts, then all of a sudden you start to balloon in weight. For me, my symptoms come back and all these other health markers changed. And I guess, that's something that will be borne out hopefully in science in years to come. What is the perfect thing? some people it might be better eating a high carbohydrate, low fat, and for some people the other way, high fat, low carbohydrate.
Yeah, and equally, there are people who can be perfectly healthy eating the diet, the Western high fat and high carb diet. There are some people who are very like insulin tolerant. There's some people who don't have these issues. So it's like, I think the problem with the way that healthcare and government health policy is run is that they try and have like one size fits all recommendations, which is just, I think it's misses the point. It's not going to work.
Yeah, I'm having a debate with the authors of our dietary guidelines here in Australia, and what I want to see change is not have a dietary recommendation, accepting that you should eat foods that are unprocessed, limit your sugar intake, and if you cannot work it out from there, go and see a registered dietitian. And to me, that's what a recommendation should be, because you can't give a recommendation to the whole community. It just doesn't work. And I think the nutrition world many in the nutrition world are struggling to catch up with that idea that you can't give specific advice for the whole community. It's very individual.
I really wish that we could just go into like a supermarket and get rid of anything that's like in a packet, and that you can't tell where it, like, if it doesn't look like it grew up a tree, or if you can't tell how many steps there were in between the tree or the ground and like what you're holding in your hand, then I think it would be much simpler.
Yeah, I remember a nutritionist telling me, quite a few years ago now, as far as advice, nutritional advice, they said to me, if it comes a packet in a can, don't eat it. If it's man-made, or if it's a natural product, eat it, but eat it in moderation. And I think that's a pretty good set of rules to go by.
It's a good start. And then it's a good start to then like do a bit of experimentation and over the top. But I don't think that people should be demonizing any one thing, and which is why I think in my answer I was kind of careful to say like really even carbohydrates, not all that bad. I think I'm fairly okay with saying that refined sugar is probably like not a great thing to have a lot of in your diet. I think I feel good enough about all of the science there and the physiology there to recommend that people.
One last question that you just sort of made me think about is that as a scientist and as I guess someone who's come into this with no particular bias about diet, has your experience over the last few years led you to believe that nutrition and how we eat is very underestimated in the treatment of diseases?
Oh, totally. I mean, like the way that what we eat and what we put in our body is the biggest way that we interface with one of the biggest ways that we interface with our environment. I feel like there's a little bit of like information overload out there, and if you get too hung up on Google, you could be like, oh, it's this plant lectin that's upsetting me, or it's dairy, or it's gluten, it's a little bit alarmist. But I do think that there's some truth in this, that people, but it's difficult because everyone's different. So you end up with, these people who go on the extreme, say, carnivore diets, and all of their inflammatory conditions sort themselves out, and then they lose a lot of weight, and then they sort of advocate for it. But I think maybe where the media represents what they're saying is that maybe these people aren't saying it's for everyone. They're trying to arm other people to try these things out for themselves. So if we look at it less as like, oh, this person is like advocating for this diet and they want everyone to do it, it's like, well, no, they're popularizing this diet, and maybe if other things haven't worked for you, then you should try that. But I think that if as a doctor someone comes in and sits down and you don't ask them about what their diet is and offer them some education or some different sources, different options to try to sort that out, then I think you're missing a trick. But I think that it's difficult in today's medicine because doctors aren't. It's almost not within their mandate, and they've got a lot of other things on their plates. It's difficult for them to deal with that as well in the time and the constraints that they have already on their job. So I think it's not a criticism per se that they're not doing it. It's just they've got a lot of things they're trying to juggle. But I think also there's, as I talked about with the diabetic patients, I think there's often a lot of resistance for people don't want to change their lifestyle. It's difficult enough getting people to walk upstairs as a form of exercise, or get off a bus stop earlier and walk to, like there's just so much like resistance to people broadly. I don't think the type of people that are listening to this interview now are going to be that type of person. I think there are equally, for as many people who aren't motivated, there are very many motivated people that do want to control their lifestyle and help modify their disease. And that's great, because I think these people are going to have the best results. But if we look at, I think they're kind of the tip of the pyramid. And so if we have this broad base of people that want a quick, a pill or an injection, or, something that's like delivered to them. And I think in a way, without wanting to get too existential, it reflects our culture as a whole. Like everything, we can order something on Amazon, it arrives tomorrow. We want to I'm speaking to you now in Australia, I can pick up the phone and like that, I don't have to wait weeks and weeks for a letter. Everything that we have now is kind of like very simple and quick fix. And so I think people will take the same approach to their own health. Yeah. And, even I know myself, it's kind of exhausting to try and think about like implementing things in your lifestyle, because we're all busy and we're stressed and it's information overload. It's like, it's easier to just do nothing than it is to take some kind of affirmative action sometimes. So, I mean, I understand. But this is like the kind of toxic environment that we're all trying to be healthy in now. So it's not surprising that not only are unhealthy people not getting healthier, but also healthy people are getting unhealthier.
Yeah, I couldn't have said it better myself. And I always say my perfect model is when a COPD patient gets diagnosed, they go to their doctor, they get their diagnosis, and then their doctor refers them to a dietitian for nutritional advice. They refer them to pulmonary rehab programs for exercise. So that pressure is then taken off the doctor. They've outsourced those things that are important in managing a patient's disease. But I don't think we're there yet. No, we're not there yet, where doctors are willing to automatically prescribe those things for patients. But as a patient, and what I've seen in the community, those sort of things absolutely should be the first line of treatment. Medication, exercise, nutrition, they need to happen. I could talk to you for hours and hours and hours, but
it's just the British accent, and people think they add an extra 50 IQ points and they want to chat to me for ages. I get stopped on the street in America, almost on the bus store.
I want to thank you very much for your time today. It's been very enlightening, and I hope that I'm sure our audience has got much out of this. So, Dr. Brianna Stubbs, thank you very much.
Thank you. And if your audience want to find me, I'm on Twitter. Sometimes you retweet my stuff, so find me on Twitter. If people want to find out more about the ketone ester, just find hvmn.com. And also we have a podcast, the Human Enhancement Podcast, so people can listen in more about that as well.
Yeah, and that's great advice. I can say to the audience that you guys are really helpful as far as giving feedback and answering questions. So if anyone has got any questions about this, feel free to contact Brianna or myself, and I can forward on information, definitely.
Yeah, please do. And if anyone has good experiences, we'd like to hear about that too.
Exactly. Okay, thanks for that. Bye for now.
Have a good one.